Live Fit Podcast, episode 104. On this Wednesdays with Will episode, may the light force be with you. This week, Dr. Will Harden is going to tell us all about a new device he has called the Light Force. And he uses it to help people heal themselves faster, better, and often without surgeries or drugs.
Treat things like rotator cuff tear in the shoulder, frozen shoulder, Bell's palsy, which is a palsy or a diminishment of normal nerve function in the facial nerve, diabetic neuropathy, disc herniations, an arthritic knee, knee sprain, meniscal tear of the knee, sprained ankle, Achilles tendonitis. It's literally endless, the things that we can address and almost immediately impact and get discernible symptomatic improvement. But really fundamental improvement. It's tissue improvement. It's not just about symptom relief. Heck, we could do that if you took enough Vicodin or Advil. And of course, there's nothing healing about that.
He discusses the difference between pain medications, surgeries, and this technology that actually allows the body to heal faster.
And the idea is a pill is ultimately intended to control symptoms until ideally the body heals itself. And a surgery is intended to address something that's been taken such poor care of for so long that it has full-on broken down and must be addressed by opening up the body. That's foolishness.
Dr. Will is very excited about his new Light Force and the broad scope of injuries that it can heal.
But if we can literally do something to impact a healing process for neuropathy, my God, of course I'm excited about this new toy. I would call it a tool, but I'm having so much fun with it, I call it a new toy. And therefore, I kind of feel like there's nothing that walks through the door that I can't potentially positively impact, and right away.
Welcome to the Live Fit Podcast with Glenn Johnson, your resource for all things that contribute to good health. You will hear expert advice and interviews with leading authorities on fitness, food, fat loss, mindset, and the mind-body connection. You will find show notes, articles, and health programs at livefitpodcast.com.
Yes, it is time once again for the Live Fit Podcast. I'm your host, Glenn Johnson, your guide to better health. Thank you for listening. I really appreciate you being here. Please take a moment to rate, review, subscribe, and most importantly, share this episode with somebody you care about. Today, I have another fascinating Wednesdays with Will episode with my good friend, Dr. Will Harden, and he is very excited about a new toy he has that is straight out of Star Wars. Not really. It's called Light Force, and it's an infrared laser that can penetrate as deep as bone in the human body, and it is used to heal muscle, tendons, ligaments, nerves, joints, and even bones. He used this laser on me the day we recorded this episode, and that was about 4 weeks ago, and my neck has felt great ever since. I had been seeing him about every week for an adjustment and a massage, and I felt great afterwards, but it didn't stick. It didn't last for longer than about a week. He used this laser Light Force on me at that time on the day we recorded this, and like I said, I feel great now. I haven't needed to go back to see him ever since. So I personally really enjoyed it. It was a very pleasant experience at the time, and best of all, it worked. So I'd like to thank all my supporters out there. If you'd like to help support the show, you can go to livefitlean.com/patron. You can also find a link on any of the show notes pages how you can participate in supporting the show. I'd like to remind you, I offer health coaching, weight management, health improvement programs, and I love to hear your questions. If you have any questions, you can email me at glenn@livefitpodcast.com. Or when you're on the website, you can leave a voicemail. Just click on that little orange tab on the right-hand side. I would love to feature you on the show. Right now, Dr. Will is going to share with us how he uses the force for good instead of evil. I'm here today with Dr. Will Harden again for another Wednesdays with Will episode. And today, Will is going to talk about a futuristic device that I think he got out of Star Wars. It's a laser beam that he can use to fight the force, to actually fight pain in your body.
I will tell you this, before I obtained it, I investigated it for months. I first learned about this about a year and a half, maybe even 2 years ago. And I've literally been considering it for that length of time, looking into it, waiting to hear what kind of outcomes are demonstrated by it. So what we're talking about is called a class 4 laser. There's another type of laser that's been around for years called cold laser. And cold laser, it worked. And it's a laser or a light that generates 0.5 watts of power. And in fact, I've had one for 6 or 8 years, and I found that it was very effective for rendering care, treating small areas like a carpal tunnel syndrome, maybe a tennis elbow, a jaw joint problem. And basically what we know is that when light tissue penetrates the skin and goes into the flesh underneath, that it stimulates tissue repair. And the way that it does that is by causing cells to take in oxygen, which is used by the mitochondria to produce large amounts of ATP. So now I'm going to paraphrase for you and tell you what all that meant. Every single cell in the human body has a little factory inside it called a mitochondria. And the mitochondria takes in oxygen and glucose, and it makes something called ATP, or adenosine triphosphate, which you learned about back in high school biology. So ATP, I could argue, is the only reason we need to eat and breathe. That is, so that we can make adenosine triphosphate, the fuel that runs every single cell reaction in the human body. So the laser has been shown to significantly increase ATP production, which causes cells to more rapidly replicate, multiply, repair, and the laser, probably because of ATP production, seems to immediately reduce inflammation and promote marked increased circulation. So that was a cold laser that offered a 0.5 watt delivery of power into the tissue. Whereas a class 4 laser, which has to do with a classification of its wattage, its power, has between 8 and 25 watts of power. So it drives the light deeper into the tissue in a much higher concentration. And whereas I really liked that cold laser, but I never got really great results with large areas, only things like TMJ, which is jaw joint, temporomandibular joint, or carpal tunnel syndrome, which is a compression of what's called the median nerve in the wrist. That's a small area to treat, and I could effectively treat that with a cold laser. But the class 4 laser is used to effectively and documentedly treat things like rotator cuff tear in the shoulder, frozen shoulder, Bell's palsy, which is a palsy or a diminishment of normal nerve function in the facial nerve, diabetic neuropathy, disc herniations, an arthritic knee, knee sprain, meniscal tear of the knee, sprained ankle, Achilles tendonitis. It's literally endless, the things that we can address and almost immediately impact and get discernible symptomatic improvement, but really fundamental improvement. It's tissue improvement. It's not just about symptom relief. Heck, we could do that if you took enough Vicodin or Advil. And of course, there's nothing healing about that. So with a class 4 laser, I can immediately impact and address healing of some really complex conditions that are either relatively untreatable, like for example, diabetic neuropathy. There really is no treatment for that. All they do is maybe give a patient something like gabapentin, which is a drug also known as Neurontin that eases nerve pain, but it's doing nothing curative. But if we can literally do something to impact a healing process for neuropathy, my God, of course I'm excited about this new toy. I would call it a tool, but I'm having so much fun with it, I call it a new toy. And therefore, I kind of feel like there's nothing that walks through the door that I can't potentially positively impact and right away. So let's say I had a condition like a lumbar disc herniation or a torn knee medial meniscus, a fairly common knee injury. And I lasered it And a week or two later, after half a dozen laser sessions, it wasn't better. Well, we know that it, in the meantime, has been stimulating ATP production. I dare say that the outcome from any subsequent surgery, which may prove needed, would be much better by having done laser for a week or two beforehand. And what I understand is that now many orthopedic surgical clinics use these after orthopedic surgery to speed up the rehab and healing of a surgery. What else can I tell you about this? I'll tell you that professional athletic teams, like the Portland Trail Blazers, they own 3 of these. NFL teams all own these machines. College football programs all own as many as a half a dozen of these Class 4 lasers, and that explains how they get players back on the field or back on the court so quickly after significant injury. They're lasering them with regularity after injury.
I have some questions. First of all, how does this differ from sunlight?
Okay. Sunlight is delivering ultraviolet, and namely UVA and UVB, which create burning or tanning of skin. But it's not really penetrating into the tissues of the body underneath the dermis. This is a form of infrared light that ultimately, by virtue of being a significantly different wavelength and by penetrating into the body, in fact it goes to and right through bone, has a completely different effect. That is to say, exposure to sunlight doesn't do anything to stimulate healing of cells other than by stimulating production of vitamin D, which is really good for us in a lot of ways. And yes, of course, that's important for overall healing, but it's not targeting tissue healing. So it's a different wavelength ultimately.
Gotcha. That's what I figured. And ultraviolet light will cause the cells to become cancerous, and infrared will not, correct?
That's right. Nothing about creating cancer susceptibility by the use of a Class 4 laser. But I should qualify that statement. Many would argue that the beneficial health effects of the exposure to sunlight, namely the production of vitamin D by exposure to sunlight, is anti-carcinogenic. Yes, we also know that the breakdown in the cellular integrity of the skin by the overexposure to UV light, and especially a lifetime of repetitive episodes of sunburn, that probably does create some cellular mutation that may affect DNA changes that affect cellular mutation that make you prone to precancerous lesions of the skin, namely melanoma.
Gotcha. My second question is, how deep will it go, and is that controlled strictly by the wattage or the power you put on it? When you touch it to the skin, if you have it on a low wattage, will it go, 1 millimeter, and a high wattage, it'll go 5 millimeters, something like that?
Probably not. Because of the wavelength, even with a cold laser at 0.5 watts, you're probably getting penetration as much as several inches deep. But with a Class 4 laser, which is delivering much more power, basically what it comes down to is what is the quantity of light energy or the quantity of photons that are being delivered to the deep tissues. Now, I haven't put this to the test, but I'm told that if you turn out the lights and put this Class 4 laser over a forearm against the skin, you can see the light shining on the wall on the other side of your arm. In other words, it goes right through the tissue, including bone.
Like when you shine a light in one of my ears?
Yeah, something like that.
Wow, wait, you haven't done that yet?
I haven't even done that yet, darn it. What am I thinking?
That would have been the first thing you would have done.
Yeah, tempting. So what it comes down to is there's a measure of energy of photons absorbed into the tissue, and that's referred to as joules of energy. And so in the course of one treatment, we might be delivering anywhere from 2 to 8,000 joules of energy into the tissue with a Class 4 laser, and that might take anywhere from 6 to 10 minutes, depending on whether we're using 5 watts or 10 watts or 15 watts. With a class 4 laser, with a cold laser, to get an equivalent amount of joules might take 100 minutes of application.
Wow.
And that's the primary difference as it relates to the penetration. It's not about depth, it's about how much power and therefore joules are being delivered into the tissues.
So what's the downside? What's the cons to using this sort of thing as directed?
Okay, so first and foremost, you may not expose the eyes or the retinas to the laser. So whenever this is used, unless the patient is laying face down, they have to wear a pair of protective goggles, and I do the same. But the truth is, you keep the contact against the skin, perpendicular to the skin, and therefore there's no reason to believe that's ever going to occur, but that is a precaution. And the other is, we wouldn't use this anywhere near a pregnant belly. So no, I wouldn't use it on the low back or anywhere in the abdomen in a pregnant woman, not because it will hurt the fetus, but because we don't know for sure. And we never want to mess with growing stem cell diverging tissues. And therefore, we wouldn't use it during pregnancy anywhere near a growing fetus. And we don't know what it does to cancers. And therefore, we want to stay away from anything that has even a susceptibility to tumors based on past incidents of tumors in a certain area, an unknown lump. And therefore, it's important to know what's going on in the underlying tissues before we just immediately start lasering it.
Yeah, good point. Good point. And you brought up stem cell, and that reminds me, I just released episode 101 with Dr. Joanne Halbrecht, and she uses stem cells to regenerate tissue, meniscus and cartilage and things like that. So this sounds very similar, but less invasive. She has to harvest stem cells from the own person's fat cells, and then she'll inject them, let's say, take it from the belly and inject it into their knee or something. So this sounds like it does pretty much the same thing without the...
It's so similar.
Without the expense. I don't know what that costs, but insurance doesn't cover it. So right there, It's expensive. So you told me before we started recording that a normal treatment is every other day for
2 weeks.
2 weeks or so,
Yes.
and then some maintenance after that. With the stem cells, it's just one for a while, and then after maybe 6 months, you can have another if it needs it. But this sounds much less invasive. Do you, and I know I'm putting you on the spot here, you didn't know I was going to ask this, but do you have any idea of the comparison between this type of device and injection of stem cells?
Well, you first mentioned something that's really key to what really clued me into this as a potential device to have in practice that might prove invaluable, and that is a fascination with what you said, regenerative medicine. That's become quite a catchphrase because people are starting to understand you just can't spend years dealing with knee pain with cortisone injections. We know that after 2 injections in the same place, it creates brittleness and weakening and reduced elasticity of otherwise elastic tissues like tendons, muscles, ligaments. And therefore, most physicians won't do more than 2 injections in the same area, though some do as many as 6 or 8. But we know that's detrimental to the ligament tissue and also muscles, tendons. So regenerative medicine has become, quite a buzzword. Therefore, instead of doing cortisone injection of knees, they're doing Synvisc injections, which is hyaluronic acid, which is the building blocks of cartilage, so that your body can make its own cartilage, having a lot of the ground substance available. Stem cell injection in the form of what's called platelet-rich plasma injection, or PRP, the precedent of which was prolotherapy, which was the injection of basically sugar, dextrose and lidocaine, because it was shown that even injecting dextrose stimulated increased replication or proliferation of new ligament or tendon tissue. So prolotherapy was used for the injection of an irritated or an old damaged tendon or ligament, and it worked. But it advanced to PRP, And now stem cell injections. A stem cell is nothing other than an undifferentiated cell. That means it's a cell that hasn't decided what it wants to become yet. So depending on where it's placed by way of an injection, it responds to that area and makes itself turn into that cell. It's just fascinating. And what this class 4 laser is doing is in a different way stimulating a regenerative process. By increasing ATP, it increases cell replication and multiplication, and ultimately is completely non-invasive, non-exogenous. In other words, we're not putting something from the outside in. It's endogenous healing.
That's fantastic. It sounds like a win-win, and as long as you're wearing eye covers and you don't have a tumor forming and you're not pregnant, it sounds like the risk is pretty much nothing.
It is considered an extremely low-risk device.
Now, just to look at all sides of this, I asked you previously what are the cons if you use it as directed. Now, let's say you don't, and you just stuck the wand with the light on full and you just held it to one part of your body, let's say your middle of your thigh, and you just held it there.
I think that would be a very foolish idea.
Granted, I'm just curious as to what would happen. Would it cook the skin or the
Ironically,
muscle?
It would almost certainly cause burning of the interior tissues, but not the skin. In fact, when I'd only had this for 2 weeks, but when I was initially demonstrated it, he held the wand still for a second and said, "You see how that burns?" I said, "Yeah, I don't like that at all." And then jerked my hand away. And he said, "Now look at your skin. There's not even redness or burning." And there wasn't.
So you'll feel it and you'll move the wand away probably before you damage the
Undoubtedly.
tissue.
During its administration, the wand that's holding it is being consistently and constantly moved.
But if you held it in one place for 10 minutes, it would damage the tissue?
I think we can safely say it would create some burning of the tissue by just simply excessive heat.
Right.
Because remember, we are delivering light energy or those joules into the tissue. And if you concentrate those excessively in one area, yes, I have reason to believe that would literally burn you.
But you're a professional, so you'd never do that. And you don't let it get in the hands of 5-year-olds.
And nobody who's untrained will ever administer this to a patient.
Right, right.
And yes, we keep it out of the control of 5-year-olds.
That's great. Well, I think it's a fantastic device. Now, on the more technicalities, does insurance cover this?
It does. And this would be typically billed as a quote, what's called other therapy. It's new enough that there is no insurance billing code for class 4 laser yet, but it is totally, on the up and up to bill it as quote, other therapy. Or even if we're using what's called the roller ball applicator. In other words, we're rolling a wand on the skin, essentially massaging it while we're delivering the laser. It would be billable even as a manual therapy.
2 weeks ago, you used this on my neck. You adjusted my neck, then you used this, and you've been adjusting my neck every week for several weeks. And so I had something to compare it with, and my neck held its proper position and was pain-free for longer than a week. I didn't even have to see you. It's been 2 weeks now. And my neck felt really good with one exception, but I was able to correct that with something that you also taught me. But I will say that it felt really nice, almost neutral, but a little bit warm. It was not in the slightest bit uncomfortable.
No
or
discomfort.
Weird. It felt almost like you were rolling like a ball massager over
Yes.
just like a ball
With
on a
some
wand.
heat.
With a little bit of heat. It was quite pleasant. And then you used it on me again on my whole back and my neck and shoulders area, and it was lovely. It was, if nothing else, it was a pleasant experience.
Excellent. And what I'm hearing from people is basically that verbatim. Everyone says that is really pleasant. And when we're done, almost everyone says, wow, my low back feels looser. It's warm down deep inside. Bear in mind that you're having one laser treatment and then having positive response. That's fantastic. And we don't expect that. There is typically a protocol of a repetition of treatments so that we're accomplishing that cumulative effect over those 2 weeks of lasering. So for you to have experienced that one treatment tells me that piggybacking them is likely to do even more.
Well, I love it. I think it's fantastic, these new methods of helping the body heal itself, because I and many people I've spoken with, I think it's kind of the general way, people are really getting sick of drugs.
Oh my gosh.
Masking pain and covering things up, putting on Band-Aids, getting unnecessary surgeries or unhelpful surgeries, when there are ways we can get actual healing to be accomplished in the area that's troubling us. I mean, everybody's getting older and things are going to break down, even if you're careful and you're not hardcore athlete.
Wear and tear over time results in degenerative change.
Exactly.
This is a tool that allows us to literally address degenerative change.
I think it's fantastic. I have high praise of it so far, and
Excellent.
I really expect to see this in more places.
This is going to become more and more popular, more and more affordable for the practitioner who wants to have one of these. And the truth is, it's just one more tool. What I love is that there are, in fact, so many tools other than drugs and surgery to facilitate healing. The spinal adjustment to stimulate improved nerve function, and of course, joint function. We know that slows the degenerative process. Kinesiotape to address a mechanical issue involving an injured shoulder or knee or spine. Deep tissue work to promote muscle relaxation, stimulate the healing process by way of circulation and relaxation. Proper stretching, exercising, nutrition, an entirely huge field of study revolving around tools to improve health. It's just almost endless, the things we can do, rather than relying on a pill or surgery. And the idea is a pill is ultimately intended to control symptoms until, ideally, the body heals itself. And a surgery is intended to address something that's been taken such poor care of for so long that it has full-on broken down and must be addressed by opening up the body. That's foolishness. I'm not saying it's not sometimes necessary. Sometimes the system breaks down and needs to be opened up and corrected. A broken collarbone in 5 places that needs to be put back in proper alignment and positioning, proper structure, so that it will in the future function. A gallbladder that's about to burst. An appendix that's so infected that if you leave it go for 3 more hours, it may in fact burst and cause peritonitis. Okay, those are obvious needs for surgical revision. A tumor that must be removed, surgical revision. But by and large, many people wait until something is so bad, and in the meantime tend to ignore it, that eventually it does need surgery. That's silly.
Yeah, I agree. It is silly. A lot of people tend to have the, Ostrich Syndrome. Ignore it, bury your head in the sand, and hope it goes away. And with a lot of things, it does. And we don't want to go to the doctor every time we feel an ache and a pain. So there's a certain amount of, foresight or wisdom in that. But at the same time, when we're just being stupid and hoping that our
right.
Appendix don't actually burst, even though they're
right.
inflamed,
it just doesn't work that way.
That's pretty bad. I'm sure a lot of people and people I've spoken with are all for these other techniques of letting the body heal and treatments, and don't really want to take drugs. But the unfortunate truth is that drugs are relatively cheap, and doctors and insurance companies would much rather give you a prescription or pay for the drugs than treatments.
Agreed.
Which it's just shows us once again what's wrong with our medical system.
Our, quote, healthcare system.
Our sick care system.
That's right.
So
that's right.
Thank you, Will. It's been a pleasure. This
Indeed.
thing is fantastic. I really love speaking with you as always, and
Agreed.
We'll talk again.
Excellent. Thank you, Glenn.
Thank you.
Thank you for listening to this episode of the Live Fit Podcast. Please subscribe and share with someone you care about. Read show notes, articles, resources, and learn more about our weight management programs at livefitpodcast.com. Once again, thanks for listening, and always remember to Live Fit.